What do we do when we have these very large restorations that we need to be more efficient during our dental procedures? So bulk fill composites have been around, or bulk fill techniques have been around for many years. There are materials available today, though, that we did not have available when these bulk fill techniques were first discussed. So the idea with the bulk fill technique, to make it more efficient, the composite, if you imagine the tooth that I have on the screen is actually a cross section, so this is an occlusal composite. And as we cure that composite, ideally all that composite should cure. But the concern has always been several issues. Number one, is that composite that is furthest away from the light, closest to the tooth structure, is that actually getting cured? One of the other issues with the bulk fill technique that we were experiencing before some of these newer materials is the stresses related to the shrinkage of the composite. So when composite is cured, when it's polymerized, all composites shrink. And when composites shrink, there are stresses that occur within the composites that can cause stresses in the tooth structure. So do those stresses ultimately cause cracking in the tooth structure? Or as that composite shrinks and there is a good bond of the composite to the tooth surface, to the walls, do you get pulling of those walls internally causing stresses? And most of us who have been practicing for a while have had this experience where we do a simple occlusal restoration. Doesn't seem like any big deal. The patient comes back and says, I can't bite on this tooth. Every time I bite down I have pain. Is that related to the shrinkage and this cuspal deformation, these cusps being pulled in as a composite is shrunk? Another issue that can happen if you have inadequate adhesion is, can the composite pull away from the tooth structure as it shrinks, creating this gap formation, which will then obviously cause problems with the longevity of the restoration. For me, the ideal situation would be to use a bulk fill material that I am confident is going to be curable all the way down to the cavity floor, but leave space after I cure that material that I could then layer with a more aesthetic veneering material, some of my nanocomposites, over the surface to give me the ideal morphology without having to carve it in with a burr, and an ideal translucency so it blends in with the natural tooth structure. So what are my issues with the current bulk fill materials available? Or where do I see some of the problems? Number one, there is some controversy on the actual depth of cure, or the distance of the cure depth with these materials. Sometimes the manufacturer's results on the depth of cure is different and not consistent with what we're seeing in some of the research reports. Also, one of the ways that manufacturers are using, one of the techniques they use to create more depth of cure with their material is they use a more highly translucent composite to help that increase that depth of cure. The problem with that is that can then result in a low value or a grayness of our final restorations, which ultimately look non-aesthetic. So what I'm looking for with my bulk cure material, I want a material that I know will cure multiple millimeters, 4, 5, 6, 7 millimeters deep, and be 100% confident that that composite is ultimately is adequately cured all the way to the base. I want a material that's going to be very strong, and I want a material that's going to not be translucent, something that's more opaque, that's going to allow me to create a natural looking restoration. So the material that I've been using for years for my bulk fill materials is actually Cosmicor, which is Cosmodent's core buildup material. And what I like particularly about Cosmicor is that it has a great flow to it, and it doesn't slump. It'll maintain its position after I inject it into the cavity preparation. I also like using these core buildup materials like Cosmicor because we have such a great track record with these core materials. They've been around for many, many years. Also, I like the fact that I have this great strength with this core material, and I believe besides making these restorations more efficient, I think they have the potential for making our restorations even stronger using Cosmicore as a build-up material before my final layering with my nanofill composites. So let me walk you through a technique that I use for using my Cosmicore as my core build-up material. So you can see in the screen on the slide on the left, there is a failing of the restoration and some breakdown of the margins of the composites and the amalgams. Now I'm going to pre-wedge. Now I'm going to remove the existing restorations, make sure that I've removed my carries, clean up the proximal walls. So in the screen on the left, you can see the completed preparation with the wedges in place. So I remove my wedges. I make adjustment to the wedges as necessary based on the nicking of the wedges that I see from the burr here. Now I'm going to place my matrix bands, and you can see my matrix band has been placed and the wedge has been positioned, and I'm visualizing to make sure that I have contact both on the mesial and the distal, and I use a blunt instrument like a ball burnisher or my multi-use instrument from Cosmonet to make sure I have adequate contact on both contact areas. Now on the distal, to help close the embrasure, I've actually taken the wedge and I've placed it from the palatal. Now at this point I'm going to go ahead and use my all etch technique. So I'm going to etch the enamel surface first before I etch the internal or the cavity preparation. Ideally, I like my composite to flow beyond the preparation to help create a longer margin of my composite to help minimize and reduce the opportunity for micro leakage. So I'm going to pre-etch the enamel surface for 15 seconds because it takes longer for unprepared enamel to etch than prepared to structure. In this case, I'm going to be using my total etch technique, so I will etch the remaining of the to structure with my phosphoric acid for 15 seconds. That gives me 30 seconds of etch time on my unprepared enamel, but 15 seconds on the prepared to structure. I rinse the etching off completely. I'm going to use Concepsis. I'm going to scrub the dentin surface for about 1 minute. That will help prolong the bond strength of my 5th generation adhesive by using my Concepsis scrub. Take off the excess moisture, and if you would like to use some sort of sectional ring to create more pressure between the teeth, I think this is an ideal time to place that. This is the Trident V3 ring, but with pre-wedging, typically I don't have to use these rings, and in this case I didn't need to use a ring at all on the distal. I like the contour that I have. I love the contact. I wanted a little bit more contact on this mesial, so I placed a ring only on the mesial in this particular clinical situation. I'm going to place multiple coats of my dual cure adhesive. Because I'm using a dual cure core material, I need to use a dual cure adhesive. So this is Cosmonet Complete with the dual cure catalyst. I'm going to place multiple coats of this adhesive, air thin it, but critically do not light cure. After it's been air thinned, now I'm going to inject my Cosmicore into the cavity preparation. In this case, I'm using one of the needle nose tips from Centrix, and I'm injecting my Cosmicore to be certain that I get it all the way down to the base of the distal box. And I'm going to flow that composite throughout the preparation, leaving about 1 to 2 millimeters of occlusal space for my final nano-filled composite, which will give me better polishing and be able to allow me to get nicer aesthetics. So on the left side of the screen, you'll see the pre-existing restorations, the amalgam and the composites, and then our final restoration with our Cosmicore as our build-up bulk fill material layered with our nano-filled composite.